Hey everyone, it's Nurse Sarah with registerednursern.com, and in this video I'm going to show you how to set up your Foley catheter tray. So we're just going to bring it up, lift these sides up, and then pull the tray out, and then put this back to the side. So I'm going to take this off and then look at what's in our kit. Here we have cleanser to cleanse the periurethral area first. We will do this first before we do anything else. And then it has directions to use, some other little education pieces in a different language, Spanish. And then these are stickers that we're going to be putting in the chart, and on our drainage tubing, we'll put that to the side. So let's prep for this. So I've washed my hands and I've donned clean gloves. So I'm going to take this out in here. And in this little package, we have the soap towelettes to clean the area. And then afterwards, we have this to wash our hands with. So I'll provide periurethral care, then doff gloves and perform hand hygiene. Now we're ready to set up the supplies. So again, when you're setting up your supplies, you want to make sure that you are positioned where your non-dominant hand is going to be closest to the patient, because this hand is going to be used to help you open the labia during insertion. So we're going to take our wrap kit. We can touch this part right now because this is the shiny side, and the shiny side is going to go on your surrounding surfaces. Remember, shiny, go on surrounding surfaces. It's not sterile, so we can touch this. So we're going to move this and we're going to orient it toward the insertion site. So it's going to go on the bed and in between the patient's legs. Now we're going to open our CSR wrap. So you have to do this in a specific way because we don't want to reach over our kit with our hand, which could contaminate the sterile field. So what we're going to do is we're going to peel this to open it, get that part off, and we are going to take this top tab off and pull it this way away from us. You have 1 inch on this dull side that is considered non-sterile, so it's like a 1 inch border that you could touch, or you could just grab the shiny side and pull. It's whatever you prefer. So pull that. Then we're going to do our side tabs. So remember, you have 1 inch. Pull like that. And then we're going to do the inside one and pull it like that. Next, what we're going to do is we're going to don the sterile gloves. Now, you never want to turn your back on this whole sterile field, because if you do, you're going to have to start over. Once the sterile gloves are on, you can't touch anything outside of the kit. You can only touch things that are inside the kit because everything is sterile. So we're going to don these sterile gloves outside the sterile field. So now let's open up our gloves, turning the package around, and always read the little words on the packaging to help you orient it. We're going to take the tabs, stick our hands underneath the tabs, and pull it out. You have about a 1 to 2 inch border to work with, so that paper folds out nice and neat so you can get in there to those gloves. I'm going to glove my dominant hand, so I'm going to take my non-dominant, grab this cuff, and I'm going to slide it over like so. Okay, this is now sterile. We cannot touch anything outside of our sterile field. And then I'm going to go under this cuff right here to glove my dominant hand. Okay, now we're sterile. Now we're going to drape the patient, and we're going to be placing 2 different pads. The first pad we're going to place is called the under pad. And the reason we're placing all of these pads is because we want to extend our sterile field. So we are going to get the under pad. It should be the top pad, and we're just going to grab it here. I want you to see both of these sides. We have a shiny side and we have a dull side. Remember, the shiny side is the side that's going to go on the surrounding surfaces, so it's going to go down. So we're going to place this under the patient's bottom. Then we're going to take our fenestrated drape and put it over the patient's genital. It's going to have a hole that gives us an area to work. So we're going to grab this and let this unfold itself. And then we're going to take the shiny side, put it on the patient, and again, being careful as we drape. Now we're going to set up our kit. And this kit is really cool because it labels every step for us. So here we have our Foley with the drainage bag. We have the securement device, the Statlock device that we're going to be applying later. So the very first thing that we need to do is we need to open the iodine. So we're going to open this iodine and we are going to put it on these swabs right here. Step 2 is pour on the swabs. So tear here. And then we're going to just put it on our swabs right here because this is what's going to be used to clean our labia. And we're going to discard this. Then what we're going to do is we're going to attach the water syringe. So we're going to just connect it to this port here. We no longer test the balloon prior to insertion because doing that, they have found, changes the shape of that balloon prior to inserting it up through the urethra. And when we change the shape, it could damage the urethra, which could cause a urinary tract infection, and we don't want to do that. So here's our water syringe. And this Foley that we are dealing with, it tells us it's a 14 French and to inflate with 10 mL of water. You always want to pay attention to that because that's really important whenever you go to remove it. So this is the port that we're going to be instilling that water in whenever we're ready to after insertion. But right now, we're just going to connect it there and set it aside because we're going to be using that when we're done inserting. The next what we're going to do is we are going to dispense the lubricant here so we can lubricate the tip of our catheter prior to insertion. This is really important, so this is a comfortable procedure as much as it can be for your patient. So we're going to take that and we're going to just put it in here and discard this. Then we are going to remove the catheter very carefully from this plastic sheathing. And you definitely want to let it coil like that because if you just pull this thing out, it's going to go flying off your sterile field and then you're going to have to start all over. So for females, we want to lubricate at least 2 inches of this tip. So we're going to put it in there. Okay, so we've prepped everything that we need. Now next up, we here in a moment are going to clean the area prior to insertion. But also in some kits, you have a urine sample collection cup if you needed that, with some labeling, and then you have your drainage bag. You always want to make sure your kit came with the drainage bag because if not, you would need that, and this one did.